We're looking at a critical shift in childhood health. New evidence shows that early exposure to peanuts may help thousands of children avoid one of the most dangerous food allergies. A study published last week in the medical journal Pediatrics found that around 2% of kids here in the United States are estimated to have a peanut allergy. New infant feeding guidance is showing real promise, with allergy rates among children to up to 3 years old drop off by 27%. In Georgia, data shows food allergy diagnosis are among the peanut allergies are among the highest claim line rates in the country. Let's dive into this a little bit more with Brian Vickery. He is with the Emory University and Children's Healthcare of Atlanta. Welcome to the show.
Nice to be with you. Thanks for having me on.
All right. Do you think we're hitting a real turning point here in how society manages and prevents peanut allergies?
Well, I think that we may be there. I mean, this study provides really promising, but I would consider it preliminary evidence that we may be on the right path. So the background, as you mentioned, is that the guidelines for feeding babies have recently changed based on strong evidence from studies showing that giving peanut or even egg to babies early in life dramatically reduces their risk of developing an allergy to those foods. But we still don't know whether these guidelines are really being followed, and then whether they're working to prevent cases in the real world, which is the question this study attempted to address.
What are the biggest misconceptions about peanut allergies that you wish most people would understand?
Well, I think peanut allergy is really common, and it really affects, now we think of 2% of kids, which is a lot of kids, even though that number seems small. That's 1 in 50 kids, and it's grown a lot over the last decade or so. But again, coming back to this study, we now think we have important options to prevent the development of peanut allergy by feeding babies early in life. So in this study, the researchers examined health records from large numbers of infants in 3 distinct time periods on either side of the new updated guidelines, and compared the rates of food allergy diagnosis before and after the guideline update. Now, it's important to remember that they used a definition of food allergy in the study that was pretty loose and could still include babies that were suspected to be allergic, but where it wasn't actually proven. So they did show that fewer infants were diagnosed with peanut allergy in the period after the guidelines, but interestingly, they also saw significant reductions in the diagnosis of other allergies like milk and fish, which actually, interestingly, weren't included in the guidelines. And in this study, it's important to remember that the researchers couldn't account for the actual consumption of allergen in the diet. So they really couldn't present any evidence that the reduction in diagnoses were caused by eating more of the foods as recommended in the guidelines. That could be the case, but there could be other explanations as well. So ultimately, look, I think it's a good thing that fewer infants are being diagnosed with allergy in the study, but it's a little hard to say why exactly, and we need more research in this area to better understand it.
Do we know what age, or around, you say in infants, but what age it started out as, and how would parents introduce that to their children?
Yeah, so it really depends on whether or not the baby has a case of moderate or severe eczema, an itchy red skin rash, which is the most common presentation of food allergy early in life and is the strongest risk factor for the development of allergy. So if the baby has eczema, they really ought to be evaluated early in life, between 4 to 6 months by the pediatrician and maybe by an allergist as well. And that's when we want to get these foods early in the diet. So we're really talking about the first few months of life. Now, if the baby doesn't have eczema, it's still good to get the food in the diet by 6 or 7 months of life, but it's not quite as time sensitive. Those babies that have a significant case of eczema ought to be evaluated early.
Yeah, is that the role that pediatricians and healthcare providers or child care providers should play in preventing these peanut allergies before they start?
Yeah, and I think it's really important that parents understand that this is new guidance, that, for many years before this, we were actually quite cautious about introducing these foods to babies, and we actually used to tell parents to wait, and that older guidance has really been kind of rejected or outdated. Now we have new guidance based on good science. We think diet diversity is good for babies. And this is what the science says. So, babies should be exposed to a wide variety of foods early in life. It's safe. It's easy to do. I always tell my patients, feed the baby like maybe like your grandmother fed your mother. It's just feed them foods when they're ready. The baby should eat what the family eats. You don't have to order anything off the internet to do it. You can use real foods, and it's safe and it's good for the baby.
There you go. Is there anything, we've got about 30 seconds left here. Is there anything next in the frontier of allergy prevention that gives you hope right now?
Yeah, I mean, I think we're starting to see the uptake of this guidance, and so we really want to emphasize these messages to parents, to pediatricians, to allergists, and others in the community. And we've prepared really easy to follow guidance for parents to learn all about infant feeding. If you go to our website at choa.org/food allergy.
Sounds good. Brian Vickery, thanks so much for joining us. Really appreciate the insight today.
Thanks for having me on.
All right, take care.